Host and Senior Vice President of Academic Affairs here at Rider University. And it is such a thrill to welcome Senator Menendez, Congresswoman Bonnie Watson Coleman, and Congressman Andy Kim, plus everyone else who's in attendance today to our campus, Rider University. I send greetings from President Gregory Dlomo, who is out of the country right now. When we were asked to host this event, we were honored and thrilled, and particularly given the fact that today's topic is something that is extremely important to us here at Rider. In fact, we've had several mental health initiatives occurring over the last 5 years, beginning with our participation in the JED partnership, as well as an OSHA grant that we received from the Secretary of Higher Education, which in part looks at mental health. And I'm thrilled to see so many of our faculty. Our director of our counseling center, Dr. Andy Kim, is here with us as well. And we look forward to hearing what our congressional delegate has to say. So I will turn it over to our moderator.
All right. Good morning, everyone. My name is Michael Lindsey. I am the Dean of the Silver School of Social Work at NYU and the Paulette Goddard Professor of Social Work. It's really great to be here with you this morning, and I have the extreme honor and pleasure to be with an august group of elected officials here, starting with Congresswoman Bonnie Watson Coleman, who I know really, really well based on our work together. And wherever I go, I affectionately refer to her as an angel, because given a conversation we had some years ago about the issue of youth suicide, she immediately got to work. Also, Congressman Andy Kim, thank you for being here. And Senator Bob Menendez, thank you for your work with us in co-sponsoring the legislation on Pursuing Equity and Mental Health Act. I want to thank our Rider University host. Thank you, Provost, for wherever you went. I see. Okay, thank you so much for hosting us and being here with us. And thank you all for gathering this morning to talk about such an important topic of our time. I cannot overstate the importance of mental health in our country and our society, and I think we all know how important mental health has been to us, particularly as we continue to deal with the enduring legacy and impact of the pandemic and what it laid bare for many of us in terms of our mental health. I'm so grateful to our partners in government who are hosting this discussion and recognizing the gravity of the situation. And again, I mentioned Congresswoman Bonnie Watson Coleman as an angel because she has definitely led the work in this space even before the pandemic, and joined by Senator Bob Menendez as well. So as I mentioned, the last few years have taken its toll on us in terms of our mental health. According to the National Alliance on Mental Illness, 1 in 5 adults in America experience a mental health disorder each year. And about 20% of them, only 20% of them, are receiving care, or less than 20% actually. And you know, what's interesting is that it represents about 20% of our society that has a mental health issue. But the reality is that perhaps even more of our society suffers from mental illness because of it not being documented, right? So many more suffer. 1 in 6 children between the ages of 6 and 17 years old are dealing with a mental health issue. And only about half of those folks did receive any mental health care in the last year. Here in New Jersey, the numbers are really, really challenging and difficult to see, and it reflects what we're seeing in the larger society. So 1.1 million adults have a mental disorder according to NAMI, but that's about 3 times the population of Newark. And 72,000 New Jerseyans between the ages of 12 and 17 years old have depression. 72,000 between that age group. Our young people have been especially hit hard by stress, isolation, dislocation, deprivation caused by the pandemic. A recent CDC report indicated that 29% of high school students have experienced mental health challenges during the past 30 days. 29% of high school students. Untreated mental illness can have long-lasting effects on a teenager's life, as we know, and can endure even in adulthood. For instance, we know that high school students with depression are more than 2 times as likely to drop out of school than their peers. Sadly, some of our children are hurting so much so that they contemplate ending their lives, and occasionally they follow through with it. More than 1 in 5 high school students who answered a CDC survey said they seriously considered attempting suicide during the last year. 1 in 5 high school students. Let that sink in. So many of our children see no other option than to engage in self-harming behaviors. And when we look at Black, LGBTQ, and female students, the rates are worse. My own research at NYU found that the suicide attempt rate increased by 73% between the years 1991 and 2017 for only one group, and that was Black youth. Later, we looked at data from 1991 through 2019 and saw that that increase was 144% for Black youth. Tragically, even younger Black children are completing suicide. I'm reminded of a conversation that I had a few years ago with the mother of a young kid who died by suicide, Rylan Ty Hagan, 17 years old. He lived in Washington, D.C., which resonated for me because I'm from D.C., and he died in November of 2017. I'd interviewed her for a book project that I was working on, and she told me, sadly, the story of going out one day when Rylan had stayed home from school because it was a teacher resource day. She came home she actually called before she returned home and said, "Rylan, I want you to help me with the groceries when I get back home." And he said, "Okay." And then she came back home to discover the unimaginable. When she went to the door and called out his name, Rylan didn't answer. She went to his room and found him deceased. I had no idea, she told me, that Rylan was struggling with any kind of mental health issue, and not even a mental health issue, but suicide. Suicide. So, like so many of the parents with whom I have talked to from around this country and the work that I do, she saw no signs that he was troubled. My own research, again, documenting what is happening with Black youth suicide, has discovered that Black youth are almost 3 times more likely to attempt a suicide without showing any of the typical warning signs like thinking about suicide or planning suicide relative to white youth who reported thinking about suicide, planning, and attempting suicide. And I'd go back to the conversation I had with Rylan's mom. She said to me, "You can share my story with the world wherever you go, but I want you to help me to understand, when all is said and done, why did I come home to find my son dead? Help me to understand that." So I've called all of the trends that I've documented this morning, the work that we've been doing, a Ring the Alarm moment, which was the title of the report that was commissioned by Congresswoman Watson Coleman and the Congressional Black Caucus, the Ring the Alarm report, the crisis of Black youth suicide in America. I was honored to lead the working group of experts that produced the report for the CDC Emergency Task Force on Black youth suicide and mental health. The report helped to inform important legislation that has just been reintroduced into the House of Representatives, the Pursuing Equity in Mental Health Act. We're thankful that this bill, which will benefit all youth, is led by Congresswoman Bonnie Watson Coleman, and that Congressman Kim and others have co-sponsored it. The bill authorizes $995 million in grants and other funding to support research to improve the pipeline of culturally competent providers to build outreach programs that reduce stigma and develop a training program for providers to effectively manage disparities. A companion bill has been introduced in the Senate by Senator Menendez. Thank you so much for helping us move this issue forward. Today you will hear from Congresswoman Watson Coleman and Kim and Senator Menendez about what comes next, how all of us in this room can support what this bill provides. As the Dean of the NYU Silver School of Social Work, I think about educating tomorrow's social workers, many who will go into the field of behavioral health and be providers or researchers. I look forward to seeing our nation invest more resources into the mental health of our young folks. With that, I'd like to introduce Congresswoman Bonnie Watson Coleman, who serves as the state's 12th congressional district. She is serving her 5th term in the United States House of Representatives. A proud member of the Congressional Black Caucus, she is a key member of the Appropriations Committee and is chair of the Policing, Constitution, and Quality Task Force in the Congressional Progressive Caucus. Please welcome our very own Congresswoman Watson Coleman.
It is so good to see so many people here and so many people from different walks of life here and from different parts of the state of New Jersey. I'm delighted to be here with Dr. Lindsey. He calls me his angel. I call him my angel because he really steered us through the hearings and the discussions and recommending the solutions that we put in a report as well as the legislation that came as a result of it. I'm proud to be here with my Senator Menendez, who has been our partner in trying to get this legislation over to the president's desk, let me just say that. And I am very proud to be here with Representative Andy Kim, who took you all away from me, and he's now your representative, but we've been a partner in working on this issue because we think it is so vital to our well-being.
Don't hold a grudge.
I didn't hold a grudge. Actually, I was really nice with him when we were campaigning. I'd go around with him in the districts that he was taking away from me. So thank you all for being here. I want to thank Rider College University for hosting us. I want to thank the provost for being here. My sister, my good friend, the Director of Diversity and Inclusion, Dr. Pruitt is here, Pam Pruitt. I'm so happy to see her this morning. Professor Micah, where are you? Rasmussen is here somewhere, and I'm so glad to see him. I remember him when he wasn't a professor. I'm happy to see that he is working in this space right now. And David Russo, he is here. I don't know if he's managing money or problems, one or the other, because he did both when he was in state government. Seriously, I'm glad to see you here. I'm glad to see one pastor that I know well, Dr. Brooks, is here, because I think it's important that the discussions that we have around mental health, particularly how it impacts the Black community and the brown community and the community that thinks that, I don't need to see a therapist, I can just have a little conversation with Jesus. Well, we believe in that. We believe you can have a little conversation with Jesus or with whomever you acknowledge in your belief system. But we also think it's important that you recognize that if you have a broken bone, you don't just talk to Jesus about it. You go to an orthopedist. And so that's kind of where we want the whole issue of mental health to be discovered. I don't have to go through all of the statistics that Dr. Lindsey shared with you. I will tell you this. Believe it or not, Facebook can be helpful. I came to this issue because I was waking up in the morning, opening up my Facebook page, and seeing these posts regarding suicide thoughts, suicide attempts by young Black boys and girls. Some as young as 5 years old. 9, 12, 11, 13, it just stunned me that you would consider ending your life as a solution to your problems so early in your lifespan. And so I said to my staff one day, after having seen this for like a couple of weeks, every day there was something, hey, I know we can't fix everything, but we can doggone sure elevate the conversation so that those on the Hill, like our senator and like our congressman, will know that this is an area that we need to pay some attention to, and the government needs to put resources into it. And that we need to look at not only what's happening with Black and brown and poor, not only what's happening with women, not only what's happening with them, but with everyone. And so for me, as we explored this issue, and as we attempted legislation, policy discussions, and Zooms and personal panel discussions, we recognize that this is a growing crisis, and that it doesn't really know its boundaries as it relates to race, creed, color, gender identification, or economic well-being. But what we do know is that there has not been sufficient support coming from the federal government with resources to ensure that those who have the most difficult time to access health care, as well as mental health care, that not only is there accessibility, but that we are actually researching the uniqueness of the issue in communities of color. And as a result of the work that we did, and that the senator and the congressman worked with us on, we succeeded in getting the National Institute of Minority Health to look at who was getting grants to study what was happening in communities, who was looking at the grants, who was working for the institutes that would ultimately approve the grants. And coming out of this work that we've done was an awareness on the part of NIMH that they needed to sort of reorganize, restructure. And so they're creating a structure where they're being more inclusive in what gets studied, what gets awarded, and who gets to evaluate those, and who gets to work there in the institution. And ladies and gentlemen, students and otherwise, that's important, because for too long, our issues were not being understood. They were not being recognized. And part of the reason that we founded this task force was to elevate this discussion. Part of the reason why I'm a co-founder of the Congressional Caucus on Black Women and Girls is to raise the discussion for those who've been sort of marginalized, left out. Because I believe in the heart of hearts that if we look at eliminating barriers and creating opportunities and making things better for people who are marginalized or underrepresented or underserved, if we create systems that address and eliminate those barriers, then we will lift up everybody. And so we're here today to do more listening than we are to do talking. And I am grateful that Congressman Kim allowed me to come back into the district. And I'd like to throw it over to him.
Yeah. Thank you. Hi everyone, I'm Andy Kim. I'm Bonnie Watson Coleman's sidekick. But I want to echo what's been said so far, that what would be most important about this gathering here is about having an honest conversation with one another. That I enter this room with a tremendous amount of humility. I don't have all the answers. None of us do. We have a lot of experts here in the audience that have more experience and understanding about this than the four of us do. And that we have to all try to come together in that kind of capacity and just try to figure out how we try to approach this in an overarching way. I come here not just wearing my hat as a representative of this area, but also as a dad. I got a 5-year-old and a 7-year-old. My 5-year-old spent about half his life living through a pandemic. They've experienced a level of just separation and isolation that I can see still reverberating through them. And I don't know what to do. And I spent a lot of my time talking to principals and educators and others that are talking about the deep challenges that our youth are having in this country right now. And I try to think through that, both in terms of their parents, of those children, but also my own kids. And I have to say, I'm worried about what kind of America my kids are growing up into. And I don't want them to grow up in an America that is doomed to have this level of prevalence of mental health challenges as just sort of a baseline that we just need to accept. That we have to recognize that this can change, it needs to change, and we have to figure out how to do it, because we're not on just some teleological path as a nation to heal across a lot of different things. So what is it that's going to bring that about? Yes, a lot of what we can do from the federal government side is about the resources, and we're thinking about how to try to push that in terms of resources out there for healthcare. There's a lot that we need to be thinking about in terms of the workforce. What is the right workforce level that we need as a country in terms of mental health providers and other type of roles that can rise to the challenge of this? And a lot of this gets back to another thing that I really do feel like the federal government must do, that we're just not doing well enough, is we need to be able to work with you and others to develop that national strategy, to approach this like the national crisis that it is. For me, I spent about 10 years of my life, about a little less than a decade, working on Iraq and Afghanistan as a diplomat and as a national security official. And I saw how the government, if it wants to, can mobilize the full resources of its government. All of a sudden, just not talk about the restraints of costs anymore, if it wants to. And not only did it show me that that's possible, but I also witnessed, over the course of about a decade, a significant number of the people that I worked with in both uniform and non-uniform come back broken. They didn't come back the same, and a lot of them, unfortunately, I've had to say goodbye to. Not just on the battlefield, but back here at home. Now I sit in Congress as the ranking member on the Military Personnel Subcommittee, trying to dedicate my life and my work to trying to address this challenge for our military personnel, for our veterans, and for others. But I do that recognizing that, look, you learn a lot from a country based off of how it treats those that defend it. And I want to show that we can have that kind of push forward, that we can at least show the path to be able to work on this going forward in that way. The last thing I'll say, and I'll turn it over to the senator, but there's also just a deeper challenge that we face as a nation in terms of just our society. What we're talking about here aren't just about people who are predisposed to having mental health challenges because of their personality or their genetics. We're also talking about a society right now that's really hurting. I really do feel like and believe that we have a crisis of empathy right now as a nation. We're losing touch with just how to respect each other and be kind to each other. We have profound problems when it comes to isolation and loneliness. Challenges where we see across the board, whether that's accentuated by tech and social media in both good and bad ways. The problem of prevalence of guns in our society in terms of its direct correlation with suicides and other problems that we're facing. We have to think about that. So let's just make sure we're not just thinking about the patient. The patient is also the country and how we can deal with that together. So with that, I'm going to turn it over to our senator. Senator, over to you.
I get to say something first.
Oh, yeah?
I need you to understand the significance of having this senator be the sponsor of the legislation in the Senate. He's not a junior senator. He's not a newcomer. He is a leader with tremendous respect in the Senate. And when he sponsors a bill, which he readily sponsored, almost ASAP, it signals to the rest of the Senate, better pay attention to this because it's coming from Senator Menendez. And with that, I just needed to preface your comments.
I rest my case. First of all, it's great to be here at Rider University. Provost, thank you for your warm welcome. I normally come here for Boys State, so it's great to be here for a different and more, and not more important, but equally important purpose. I'm thrilled to be sitting next to an angel. And since I represent the whole state of New Jersey, she can't hold any part of her district being gone as a result of me. But Bonnie Watson Coleman is a force of incredible ability and drive. And she doesn't speak often, but when she does, people listen. And so I'm thrilled that she is leading this effort, which I'm proud to be joining her in the Senate. And Congressman Kim is just an extraordinary public figure who uses his life experiences in so many different dimensions. You think of him maybe as a national security expert, but he took that reality of those who served our country abroad and came back very often with wounds that are not seen, and adds that to the dimension we're talking about today. So it's really great to be joined by my two colleagues here who are exceptional to discuss one of the most important issues, I think, that our state, and for that fact the nation, actually faces. And of course to have Dr. Lindsey here as well, who's just such an expert in this field. But above all, I'm thrilled to have all of you, because what we are going to do here, I believe, is listen. And if you can't lead unless you listen. And if there was ever a issue in which listening is so important, it's this one. It's appropriate because when it comes to mental health, listening, I think, is one of the most important things that we can do. By listening to each other, we start to bring down the walls that divide us, walls that sometimes we put up ourselves because of the stigma that saying I have a mental health challenge often has. And it isn't, asking for help isn't easy. In fact, sometimes it requires immense bravery and courage to reach out and admit to others, I'm not okay. But when we foster an environment of listening, we make it easier for others to get there. We make it easier for them to get the treatment they need. And getting that treatment is something I know we want to talk about, because that's one of our challenges in this society, the access to that treatment in a timely fashion. But by listening, by talking openly and honestly about things like depression, anxiety, loneliness, we start to peel back the curtain. So we start to let people know it's okay not to be okay. Now, it's also fitting that we're doing this in May, which is Mental Health Awareness Month, and we need to make it more than a month's challenge. It's an annual challenge as far as I'm concerned. But it's also a moment to recognize the landmark bill that the Congresswoman has authored, the Pursuing Equity in Mental Health Act, which I'm proud to be the Senate sponsor of. As you heard the doctor say, it provides for nearly $1 billion. I noticed that she made it $995 million, so it's sort of like didn't round up to $1 billion, but it's pretty close to that amount of money. And it is part of the reality of the challenge we need. But beyond the money, it's about a particular focus on closing disparity gaps among different groups. We talk about Black and brown communities, but LGBTQ communities, those who have faced gun violence, and others equally need this type of help. And for too long, it has gone underfunded. The fact is that despite laws on the book that mandate parity, which I have voted for, between physical and mental health programs, despite the fact that communities of color struggle with mental health at equal, if not greater rates than others, there still exists drastic gaps in both how we diagnose and treat mental health in Black and brown communities. And there's an enormous amount of stigma associated with seeking assistance for mental health, which brings me to the reason we're here. If we know the task at hand, if we take steps to address it, then today's listening session is also about not only taking away the challenge, but also the opportunities, understanding best practices, understanding how those of you who are practitioners and or community advocates have seen the ability to have some success that we should be able to replicate across the country. Strategies that put patients first and provide hopefully competent treatment. I'll close by saying last year I conducted in Hackensack a similar roundtable, but it was focused on youth mental health. We heard from students and parents and counselors and experts, all of whom talked about the last few years that has been mentioned here, and the subsequent lack of access to care having significantly affected them. I'm going to date myself, but when I grew up, it was an air raid drill. You put your head under the desk because the Russians were going to bomb. But today is an active shooters drill. And to listen to young people, I have 4 grandchildren, and to listen to my eldest grandchild, Evangelina, named after my late mother, that Grandpa, we had an active shooters drill. I said, what does that mean? And she said, well, we had to basically get down and hide from somebody who might come in and shoot. Evangelina's 6 years old. So if that's where we're at in that regard, and of course the pandemic, the learning loss that took place in the pandemic, which we need to address as well, all of these things make it, in my mind, a national imperative. And that's why we're here, to listen, and then to go to work to make that national imperative challenge be met. I sit on the Senate Finance Committee that deals with healthcare and the resources for healthcare. So I look forward to being an ally to the Angel to see if we can get this done. Thank you very much.
In fact, let's give both Congress members and the Senator another hand. So I'm going to start off with a few questions for each of our roundtable members this morning, and then I think we're going to open it up to some Q&A from the audience. And so I'm going to start with Congresswoman Bonnie Watson Coleman. You've been a champion for mental health equity for a long time. What does a more inclusive and comprehensive mental health healthcare system look like to you?
Thank you. One that's fully resourced, one that has culturally competent providers, one that recognizes that right now we've got less than 3% of our psychiatrists, and I have no idea what the psychologist percentage is, that actually understand the issues facing Black and brown communities. One that treats mental health illness as an illness and not a stigma, and one that looks at all of the communities, from those who you think are just okay because life is good, to those are a challenge because they're LGBTQ or transgender or whatever, but that every one of them has respect and has access to somebody who can help them work through their issues. I think that, to me, healthcare is a right in this country, the richest country in the world, and that healthcare for your mental health should be treated in the same way that the healthcare, your physical health, is dealt with.
Excellent, excellent. I'm going to transition now to Congressman Kim, and again, we're going to go through each of the panelists here this morning and then circle back to the audience. But in March of this year, Congressman Kim, you led an appropriations letter requesting robust funding for veteran suicide outreach and prevention programs. Can you tell us what that letter was about and why this appropriations request was important to you?
I've spent a lot of time, I represent Joint Base McGuire-Dix-Lakehurst. And I didn't come to Congress necessarily thinking that so much of my effort would be focused on the military personnel. But, after going and talking to a lot of the people at the base, I remember this one young woman serves in uniform talking to me about the challenges that she's had when it's come to mental health. And she talked about how she went to the medical facility on the Joint Base one day and told them that she was having a really severe challenge right now and that she was considering suicide. And their response to her was, "Can we schedule you in maybe 3 to 4 weeks from now?" And she just, it was absolutely horrific. Just that lack of, again, just understanding, that lack of urgency. And that, I would love to tell you that was the only incidence of that kind of nature that I've heard, but I've heard, unfortunately, far too many. And now in my role in the Armed Services Committee, I hear from all over the country. So again, to the point I was just saying earlier, what is our objective? What are we trying to get towards? Finally, just January this year, we've gotten to a place where a veteran who has having a suicidal crisis can go to any VA or non-VA facility in the country to be able to get immediate care. Like that, it took 2023 for us to get to that place. It's a step forward, but again, still not enough. So that's the kind of effort that I hope we can kind of get towards. And in a lot of ways, I focus on this because even in this divided government right now, I hope that we can at least try to find agreement upon these issues of mental health, and especially for those that serve our country and protect our democracy. So that's the kind of effort I'm trying to build towards, of just this kind of recognition of that universal access, and to have a response that shares the same level of urgency that many of our in this room right now have.
Thank you. Powerful. Senator Menendez, recent studies show that the average wait time to access behavioral health services is 6 weeks. For adolescents, it can be even longer. What can be done to address increasing waiting times for mental health services?
Well, it's one of the critical questions that we're trying to deal with, because, very frankly, there are not enough providers. And that's just a reality. We have to deal with that reality. That's why I was proud of the Consolidated Appropriations Act of last year to get 100 new slots, particularly for graduate medical education in psychiatry. That's a drop in the bucket in terms of what is needed. Which is why I'm also pursuing my Physicians Shortage Reduction Act that would bring us 14,000 new doctors across the country over the next 7 years, 2,000 a year, to build upon the 1,000 extra that I got last year. We just have a provider shortage. And so if we have a provider shortage, we don't have the trained, culturally competent individuals, which is another dimension of it as well, to be able to answer the phone when somebody finally has the courage to make the call. And that has to end. Because the last thing, if government is supposed to secure the safety of its people, I see that in many dimensions. Part of the safety of its people is to be there to respond when you need help, and help that ultimately may save a life. And so 6 weeks, 4 weeks, even a week after you get the courage to make a call is not acceptable. And so dealing with the provider shortage is a big part of what we need to do, so that there's somebody there to answer the phone and take the patient.